Imagine a world where the frustration of fumbling for reading glasses is gone forever. That's not just wishful thinking anymore, it's becoming a reality. The U.S. Food and Drug Administration, FDA, has just given the green light to a revolutionary product called VIZZ, a once-daily eye drop designed to restore near vision for millions of people struggling with age-related presbyopia. But here's the kicker. This treatment doesn't just sharpen your vision. It does so while minimizing the side effects that plagued earlier solutions. Presbyopia, the gradual decline in the eye's ability to focus on close objects, affects over 120 million Americans and hundreds of millions more worldwide. For decades, the go-to fix has been reading glasses, bifocals, or the awkward habit of holding books and phones at arm's length. While these methods work, they're far from perfect. They can be inconvenient, uncomfortable, and let's face it, a little disheartening for those who aren't ready to embrace the signs of aging. Enter VIZZ, a game-changer that could redefine how we approach vision care. So what makes VIZZ different? The secret lies in its active ingredient, aceclidine. Unlike earlier treatments like VUITY, which relied on pilocarpine and often came with downsides such as blurred distance vision, eye strain, and even potential retinal concerns, VIZZ takes a more targeted approach. It works by subtly narrowing the pupil, creating what experts call a pinhole effect. This mimics the natural action of squinting, where scattered light is blocked, allowing only focused rays to enter the eye and sharpen near vision. Dr. Asaf Halali, head of ophthalmology at Clalit Health Services in Dan Petah Tikva, explains the science behind it. Around age 40 to 45, the lens of the eye begins to lose its flexibility, making it harder to focus on nearby objects. People start holding their phones or books farther away because their eyes simply can't keep up. Reading glasses have been the default solution, but now we have a better option. Halali emphasizes that the concept itself isn't entirely novel. Back in 2021, the FDA approved 2 other eye drops based on pilocarpine, a medication originally used to treat glaucoma. However, aceclidine offers a more refined mechanism. By targeting only the pupil and leaving the ciliary muscle, the part of the eye responsible for focusing, largely unaffected, VIZZ reduces the risk of discomfort and strain. This precision is what sets it apart from its predecessors. The clinical trials for VIZZ spanned over 30,000 treatment days, showcasing its safety and efficacy. Users reported milder side effects compared to previous options, including fewer headaches, less eye heaviness, and minimal blurriness. Even more impressive, its effects last up to 10 hours, 4 hours longer than pilocarpine-based alternatives. For anyone who's ever forgotten to reapply their drops midday, this extended duration is a major win. But this isn't just about convenience or clearer vision. It's also about quality of life. When you don't have to depend on reading glasses, especially as you age, it changes how you see yourself, Halali notes. It boosts confidence and self-esteem. You feel younger, more capable, and less restricted by the limitations of aging eyes. Of course, no breakthrough comes without questions. While VIZZ promises significant benefits, some may wonder whether daily eye drops are a sustainable long-term solution. Could there be unforeseen consequences down the line? And how accessible will this treatment be for the average person, both financially and geographically? These are valid concerns worth exploring further. VIZZ is set to hit U.S. pharmacies later this year, but its availability in other countries, including Israel, remains uncertain. This raises another thought-provoking question. Should innovative treatments like this be prioritized globally, or should regions tailor their approaches based on local needs and resources? As we stand on the brink of this exciting advancement, one thing is clear. The future of vision care looks brighter than ever. What are your thoughts? Do you think VIZZ will live up to the hype? Or are you skeptical about its long-term impact? Share your opinions in the comments. We'd love to hear from you.